coughing, a runny nose, body aches. While none of it's pleasant, as long as it's mild, you may not need medical attention.
You just want to isolate away from other people so other people don't get it. You want to use fever-reducing medicines as directed.
Dr. James Hurd, the chief medical officer at Baylor Scott and White All Saints, says it's still a good idea to call your doctor. He suggests making use of virtual options. Flu and COVID have similar symptoms: fever, tiredness, headaches, body aches, and chills, and that can make them hard to tell apart. Dr. Hurd says it's a good idea to get a test because that can change your treatment options.
If you're at high risk with either influenza, you can get Tamiflu. If you're at high risk for complications from it, or if you're at high risk for complications from COVID, you can get, there's 2 antivirals.
We know those antivirals can be tough to come by for COVID, so in the meantime, the doctor suggests rest and recovery. Dr. Hurd says more natural remedies may not help greatly, but they certainly don't hurt.
Especially take vitamin C and some zinc and some multivitamins, but there's no good data that it truly helps. But if it's not going to hurt, it makes you feel better. And if you're honestly, if you don't have a good diet replete with vitamins, it's good to take those anyway.
Regardless of the virus you're fighting, it's important to recognize signs of distress and when to seek immediate help. Some of those symptoms: severe shortness of breath, confusion, pain or pressure in your chest or stomach. Brooke Katz, CBS 11 News.
And Dr. Hurd says your best protection remains the vaccines for both flu and cold. And remember, for those medical treatments for both flu and cold, the earlier you get them, the better.